Now, still on that story, President William Ruto has defended the planned setup of a United States Ebola quarantine and treatment facility at the Laikipia airbase. The president says the facility is part of a wider preparedness system that will help in tackling emergencies such as Ebola outbreak. Ruto was addressing the media while in Wajir said 25 counties have been classified as high-risk areas for a possible Ebola outbreak. And as Fatma Chidagaya now reports, the Ministry of Health says all 26 points of entry into Kenya are closely monitored.
Kenya is tightening its guard against Ebola as the outbreak of the Bundibugyo strain continues to raise concern in the neighboring Uganda and Democratic Republic of Congo. Now, President William Ruto, while speaking to the media in Wajir County, has come to the defense of the Ebola quarantine facility in Laikipia, arguing it was necessary. According to the president, the facility is part of the government's Ebola preparedness program aimed at preventing, detecting, and responding to public health emergencies.
What the American government is doing is to work with us in partnership to build the capacity to make sure that if ever we needed a facility, that facility will be there to serve the people of Kenya and to serve our friends, including the Americans.
And here in Nairobi, at a meeting held at Afya House, Health PS Mary Mudhoni said the country remains on high alert despite having no confirmed Ebola cases. She says the government has now established daily review meetings through specialized subcommittees tasked with assessing risk and coordinating rapid response measures.
There are those counties that have been mapped out as either very high risk, others are high risk. As at now, we have been able to sensitize more than 1,000 healthcare workers.
As part of the preparedness plan, 25 counties have been classified as either very high risk or high risk. The very high risk counties include Nairobi, Mombasa, Busia, Kisumu, Bungoma, Trans Nzoia, Turkana, Migori, Siaya, Homa Bay, and Uasin Gishu, amongst others. Authorities say that these areas have been prioritized because of their proximity to border crossings, transport corridors, and population movement patterns. Fresh data from the Ministry of Health shows that more than 13,000 travelers were screened at points of entry in the last 24 hours, bringing the cumulative number screened to nearly 67,000. More than 1,000 health officers have already undergone training.
It is good to note that we have assessed the ports of entry and the readiness at the ports of entry, and we will continue deploying the healthcare workers at the ports of entry so that we can build on the capacity that is there. As at today, in the last 24 hours, we have been able to screen 13,548, and cumulatively, we have been able to screen more than 66,000 travelers.
Meanwhile, the World Health Organization says the Democratic Republic of Congo has recorded more than 300 confirmed Ebola cases, with dozens of deaths reported, while neighboring Uganda has also confirmed infections. With no approved vaccine currently available for the Bundibugyo strain, Kenyan health authorities are urging the public to remain vigilant. Fatma Chidagaya.